The Centre for Excellence in Child and Family Welfare, Tasmania, Victoria, acknowledges the traditional custodians of the lands and waterways on which we live and work, the Palawa of Lutruwita and the Wurundjeri people of the Kulin Nations. We pay our respects to elders past and present, and we honour their enduring strength and aspirations for the future of their young people, communities and lands. Welcome everyone to today's AVITH in Context webinar. I'm Carolyn Davies, one of the Senior Project Officers at the Centre for Excellence in Child and Family Welfare, the peak body for child and family services in Victoria and Tasmania. Okay, so the AVITH in Context webinar, which we are here for today, is our webinar series where we hear from different professionals in different disciplines and fields, and we look at the different contexts and presenting issues that impact a young person using violence in the home and their family members. We have Dr. Ashley Curtis and Dr. Travis Harries. Dr. Ashley Curtis is a senior lecturer within the School of Psychology at Deakin University and is stream leader of the Experiences of Harm in Vulnerable Populations group within the Connect Research and Training Initiative in SEED. Ashley's research focuses on the factors that impact aggressive and violent behaviour across the lifespan in community, clinical and forensic settings, including substance use, trauma, and neurocognitive impairment. Her research identifies relevant factors for aggression and violence intervention and ways to improve engagement with intervention to reduce aggressive and violent behaviour. And Dr. Travis Harries is a lecturer in psychology at Deakin University also, and a member of the Connect Research and Training Initiative. His research area is also in family violence with a specific focus on child-to-parent violence and parent-directed aggression. His research explores the family conditions which predispose and perpetuate child-to-parent violence, with an emphasis on dynamic risk factors which can be modified through formal interventions. He also works in the intimate partner violence space, understanding how early life experiences, including child-to-parent violence, can contribute to the experience of partner violence in adulthood. In this particular session, Dr. Ashley Curtis and Dr. Travis Harries will discuss their recent research into substance-involved child-to-parent violence. And you might see that written as SU-CPV, just to demystify that abbreviation. So we know that child-to-parent violence, or as we tend to refer to it in our conversations, AVITH, adolescent violence in the home, we know that this can be associated with youth alcohol and substance use. But in terms of research, there aren't a lot of studies that have really kind of given the context or the familial background and context to the issue. So that's going to be what our research team will be sharing with us today. And I will now pass over to Travis, if you're good to go, or Ashley, sorry, I'm not sure who will begin for us today.
It's me. Thank you so much, Carolyn, for that introduction. Quite lengthy bios that we need to probably cut down a little bit. But thank you so much for having us here to talk about this really important topic, something that we are really passionate about and have been working quite a lot on recently. So we're really excited to talk about it and what we've been finding today. So to jump in, I wanted to start us off in this presentation today, just talking about what has been, I guess, the most utilised definition of child-to-parent violence in the literature. A lot of the literature in the field comes out of Spain, and this definition on the screen is out of a research group in Spain as well. And I wanted to highlight it because I think it's really important for understanding where the current literature base is at and why. And that is because having a look at this definition on the slide, we can see it's referring to repeated behaviour of physical, psychological or economic violence directed towards parents or people who occupy their place. In bold there, excluded are one-off aggressions that occur in a state of diminished consciousness which disappear upon recovery. For example, intoxication, withdrawal, They go on to talk about mental health, psychological disorders. And of course, there are many reasons why having those things excluded we might consider to be more problematic. But it explains to us why the literature on substance-related or substance-involved child-to-parent violence has really been lacking, despite knowing that there has been a really strong association in the broader substance use and violence literature. So we know that it's really important to consider substance use when we're talking about child-to-parent violence for two kind of key reasons, and that is because it impacts on the risk for the young person, but it also impacts on the needs of the young person as well. So we know that over many, many years, and as I mentioned before, substance use is consistently associated with aggressive and violent behaviour, and we know that it can increase the likelihood of aggressive behaviour. This research has been going on for 60 odd years. There was even a paper that was written about this relationship that showed that even over the last 30 years, there has been so many research studies done where you get people intoxicated, you provide them with a task where they're required to become competitive or aggressive, you match your participants on every other factor except the substance use, and we see that those people who are using substances or become intoxicated are far more likely to be aggressive than those who are not intoxicated. And so that's really important for us to consider here, because it means that the substance use is playing some sort of important role in the aggressive behaviour. But we know that not everybody who uses substances will become aggressive. And so there's something about the kind of mix of factors that come together for a young person that may result in them being more likely to be aggressive. And Travis is going to talk about that a bit more further into this presentation. The second reason why it's really important for us to consider substance use and its role in the violence that young people are using in the home is that substance use can increase the severity of the aggressive behaviour. So we know from the very, very limited literature in child-to-parent violence, but more broadly from the adult literature in intimate partner violence, that where there is substance use, we see an increased severity of the aggressive behaviour. And we theorise that that is likely because substance use is acting as a disinhibitor, which means that it is leading young people to maybe go further than what they otherwise would have had they not been intoxicated. And again, a lot of this comes down to the kind of factors or the risk factors, the presenting profile of the young person, which again, Travis will talk about in a few slides' time. But before we talk more about why substance-involved child-to-parent violence matters and how we kind of understand it, I want to talk a little bit about the cycle of substance use. So this is important because it informs both how we measure substance use and its relationship with aggression, but it also helps us to understand the relationship between substance use and aggression. And so I want to start here so we go into the kind of rest of the presentation with this context. So we know that where substance use occurs over time, we see this cycle of substance use. And we start this cycle, we start our understanding of the cycle in the binge and intoxication phase. So this is the stage where somebody's using substances, this could be alcohol or drugs, and over time, the use of those substances can change the way the brain understands reward. It can condition learning around when I use substances, I get these positive outcomes. And it kind of reinforces what the substances are doing for that young person. And it could also be that the substances are removing negative emotions or negative feelings as well. So for whatever the reason the substances are being used at this point, the use at the binge and intoxication phase is really important because it's what develops conditioning and learning over time. And it also is at this point where continued binge and intoxication behaviours can lead to substance use becoming quite salient for the young person, meaning it becomes their number one priority. It can become the most important thing in their life, the thing they're striving to seek out. Their attention goes to the substance use. What then happens is that has some impacts on the brain. talk about more about that in a second. But first, the next part of the cycle that's important to touch on is what happens when somebody stops using substances. So if you've been binging for some time or you've become dependent and you stop using substances, you experience withdrawal, and that naturally comes with an experience of negative affect as well. Now, this could be very short-term withdrawal. So we know, like, if we think about alcohol, we're talking about a hangover, but we could be talking about, coming down off days of use of substances. And what happens in the brain is that we deplete all of those great neurotransmitters we need to make us feel good. Not going to go into the detail around that today, but would love to talk about it at some point if anyone is interested. But what happens is we deplete all the good chemicals in our brain and we feel terrible. And what we're doing there is looking for ways to kind of get those back. And that usually is to become intoxicated again with the substance, which will artificially provide us with those feelings that we're no longer getting because the chemicals are no longer working in the same way. That, again, has some impacts on the brain, but mostly where the impact on the brain occurs and what's relevant for us as well to consider around aggressive behavior is the impact on the brain is at this third point of the cycle, which is preoccupation and anticipation. So this is that idea of craving. It's when you've possibly withdrawn, you then are feeling quite down, you're feeling quite negative, and you start to remember how great you felt when you were using substances. That leads to cravings, it leads to relapse. And this is the part of the cycle where executive function is actually the most impacted. And that is the way the brain functions, how good you are at making decisions, how well you can solve problems, how much you can think through future consequences of behavior are really impacted at this point. Now, they're impacted the whole way through, but they're most impacted at this point. And this really matters because the parts of the brain that substances impact are the same parts of the brain that are involved in aggressive behavior. And that's really important for us to remember as we kind of go through this presentation is if you are disinhibiting parts of your brain through substance use, those are the same areas you need to make good decisions about whether you will be aggressive or not aggressive, and they may be offline when you're intoxicated. So we can start to see sort of the mechanisms that might underlie some of the aggressive behavior at this point. Now, this is really important because this cycle informed then how we decided to measure substance use in our particular studies. So here's that acronym Carolyn was talking about, SUCPV, substance involved child to parent violence. When we went to measure this construct, when we were trying to think through how are we going to understand how substance use plays a role, we really drew on that cycle of substance use. But we also didn't really know the best way to approach it because most of the studies that had looked at substance-involved child-to-parent violence had basically just used it as a descriptive part of their sample. So just to say, 50% reported they'd used drugs or alcohol before, but there wasn't really an understanding of the relationship. But we could see from some of the literature and from the qualitative literature that it was likely to be a problem, but we had to figure out how to measure it. So we asked 3 questions basically of parents about their young person. So we asked, when the young person is being violent or aggressive towards me, they are under the influence of drugs or alcohol, they've been withholding or abstaining from their usual use, or they are coming down from drug or alcohol use. And when we looked at this in our studies, we combined these together as an overall construct of substance-involved child-to-parent violence because we weren't actually sure how many people would endorse any of these 3 things, given the state of the literature was so poor. So a lot of our research is based on this definition, and we understand that we could potentially pull these out from each other and look at each of them separately. But in our research, we have decided to condense them together to really reflect that idea that it's a cycle of substance use. And so we also want to keep in mind that because this is parent report, it is likely to be potentially an underestimate, but it also might be potentially hard for parents to report as well, given some of the stigma that can occur around parents reporting on these kind of behaviours. So we basically go into this research knowing that this our estimates around substance-involved child-to-parent violence are probably conservative and underestimates of actually what's going on in the home. But it is a great starting point. Travis, I'll hand over to you.
Thank you, Ashley. And sorry, I probably did a really terrible job of changing your slides for you. Okay, so this research that we're going to report on is concerned with trying to understand when child-to-parent violence, specifically substance-involved child-to-parent violence, is more likely. And generally, there's three factors or three types of factors that all come together to interact to make aggression more or less likely at any one time. And it's a good way to start to think about what's playing out when we see aggression, because we can often become fixated on the behavior itself rather than the sort of broader context environmentally, but also over time. And so we can think about what are called instigating factors. And these are things that are often from the environment, from the perspective of the young person, that trigger the potential for the use of aggression. So it could be, for example, a particularly harsh attempt at discipline from the parent, or it could even be that the young person perceives the parent as being harsh, regardless of whether they are or they're not. That's sort of irrelevant in terms of instigation. And this instigation can come from within the individual as well. And there is, I'll just flag here quickly, that there is a temptation to relate instigation to blame or to identify who should take accountability, but that's not the point. The point is to understand more agnostically what's the proximal sort of flashpoint for the incident. We then have these impelling factors, and these can be the state or trait factors that increase the likelihood that the aggression will be used in response to that perceived or that real instigation. So, for example, if the young person has background experiences of trauma or ongoing experiences of trauma, or perhaps in that moment their regulation system is close to reaching its limit, then that likelihood of an aggressive response is increased. But that's not always enough in many cases. We know that in some cases, there is the opportunity to actually override an aggressive response before it happens. And we refer to these as inhibiting forces or inhibiting factors. And they work against these impelling contributions to reduce that likelihood that aggression will occur. So you've sort of got two opposing forces. So for example, if a young person has very well practiced regulation strategies, or perhaps the parent can recognize and they can be responsive to an escalation that's occurring, then aggression can be avoided or minimized or less severe, even if there's strong instigation and strong impellents. And so within this model, the really serious and really severe aggression occurs in the event of what's called a perfect storm. And this is actually pretty straightforward, thankfully. It's if the instigating factor is strong, the impelling factors are strong, and our inhibition is weak, then aggression is likely, particularly severe aggression or violence. But if just one of those factors is mitigated, then that severity can be, or that risk can be reduced. And this is where the impact of substance use can be really important. Many substances, as Ash mentioned, they have a disinhibiting effect on our behavior. They make it less possible for us to override our impulses. And in situations where there's no substance use, for example, even if there's conflict, even if there's the opportunity for aggression, one of these individuals might have a history of violence, for example, that inhibition can still remain high and it can offset either that severity or that risk. But all these factors the same, but with the introduction of substance use into the picture, which creates that weaker inhibition, we then have a perfect storm for an incident of, in this case, child-to-parent violence. And so we use this model to try to think about why some parents and their young person may experience substance-involved child-to-parent violence when others don't. And just for context, we found that about 20% of our sample were reporting substance-involved child-to-parent violence. So I'll take you through the general theory that we tested and what our thinking was, hopefully relatively quickly to get to the results. So firstly, we know that adolescent substance use, it usually doesn't occur in the home. And so in order for that young person to engage in substance use, which is a pretty important prerequisite to substance-involved aggression, the young person needs to be in some way afforded that opportunity to do so outside the home. And typically this would occur in a context of less monitoring from a parent. They're generally a bit less aware and less in control of where the young person is and where they go, what they do. This gives that opportunity to use substances, or at least facilitates it. Then, based on our other research, we suspected that a lot of substance-involved child-to-parent violence might be triggered within a situation where there's an application of discipline or boundary setting, there's an attempt at it when the substance use is discovered by the parent. And so I guess we thought about who might be more likely to discover evidence of substance use with their young person. It's likely parents who are what we call more intrusive than others. And this is a terrible label. The name isn't great, but it essentially means that they're more likely to go through the young person's things, to not extend developmentally reasonable expectations of privacy. We know this is a general risk factor for child-to-parent violence, and it might be particularly relevant in this context as well. And so we thought broadly that this combination of lower monitoring, but also high intrusiveness would in effect contribute to some kind of instigation over time. Now, I also want to flag here just quickly, there's a variety of reasons parents might display these behaviours. We're certainly not suggesting that it's some kind of moral failure. This could be due to broader things going on in the family, intimate partner violence in their household, past experiences or current, for example, that are impacting on their ability or their capacity to provide responsive care. And so what may impel substance-involved child-to-parent violence once there is some instigation? Thought that where the young person has higher levels of what we call effective reactivity, which essentially means higher trait or stable levels of frustration and anger, again, could be related to a range of things. We thought that they'd be more likely to aggress in these situations, particularly when they're under the influence of substances, which might disinhibit some of that ongoing frustration. And what we did was we modeled this statistically so that we looked at how these factors interact with one another to sort of cumulatively increase the risk that the child-to-parent violence the parent was experiencing would be substance involved. One factor alone of any of this probably doesn't explain much of anything. And so what we found finally, so broadly, we found that we found support for a couple of the things that we expected. We found that compared to families experiencing child-to-parent violence that was not substance involved, families where the parents had less knowledge and less control of their child's behaviours and specifically their whereabouts, their activities, they were more likely to report that the child-to-parent violence they experienced was substance involved. And this was particularly true, or a stronger effect, where the young person also had high levels of that temperamental reactivity as well. And the important thing here, and this is quite important, is that this is a sample where all parents were reporting substantial and ongoing child-to-parent violence. So levels of both of these things were already high in our sample. And so the conclusion is that they are especially high, or where they are especially high, the child-to-parent violence that's being experienced is more likely to be substance involved. Now, this might not be causal in any way, right? There's lots of alternate explanations here that might help to explain what we found. So for example, it could be that substance use is generating greater negative emotionality for the young person. That's certainly within the realm of possibility. It may also be that the young person is using substances to cope or to self-medicate with an overwhelming amount of negative emotionality. Probably both, and they're probably both feeding into each other, but we don't know that for sure. Also, perhaps the parent has reduced their monitoring behaviours because they know that doing so is likely to put them at even greater risk of experiencing aggression when they have to act on that knowledge that they gain from this. So we're not suggesting here necessarily that these are the conditions that then lead to substance-involved child-to-parent violence. This is just what tends to co-occur with it in families that are already experiencing lots of child-to-parent violence. What we didn't find, interestingly, was that substance-involved child-to-parent violence, we didn't find it was associated with more frequent aggression or aggression that was more physical, which is a bit surprising. But again, we're looking within families where the aggression experience is already really severe. Perhaps in a more general population, we would see that association with more severe aggression coming through. I'm going to go through the findings from just one more study that we did, which is a little bit more limited in nature, before I get to kind of what this means. So we also tested one more relationship as a separate study, and as mentioned, this one's a bit easier to digest. We wanted to understand if the parents' use of substances had any bearing on whether or not the aggression that they were experiencing was likely to be substance involved. That is, the young person was under the effect of substances at the time. We thought this might be the case because the parent's substance use, which might be a way to cope with these ongoing experiences and the associated dysfunction in the household and the family, this might make substances more available in the home, but also be modelled by the young person as a way to cope with that same situation that they're sort of both in. We also know that where there's more substance use in the home, these homes are typically more unpredictable, a little bit more chaotic as an environment, which is really a core mechanism for how child-to-parent violence, we understand child-to-parent violence develops. And so what we found was that parents' use of alcohol, but not other drugs, probably because we didn't get a lot of other drug use. This was uniquely related to their experience of child-to-parent violence that was substance involved compared to child-to-parent violence that wasn't substance involved. So this means that parents who experience child-to-parent violence but also consume more alcohol, they're more likely to report that their young person is affected by substances when they're being aggressive towards them. And this aligns with, I guess, this consideration of the parents' behaviours to this problem. It aligns with more of a family systems-based perspective of the problem, where we're kind of acknowledging that it's not just the young person in this case, especially as we go younger, that actually the parents, other family members all contribute to some of the risk of the behaviours of different family members in the family. And so what we can take away from this, and I want to stress here first that this is relatively preliminary. As Ash said, before we did this research, we didn't really even have a way to measure this properly. So it's just a starting point at this stage. The take-homes are a bit conservative. We're actually actively looking for a PhD student as well to take on this topic and give it more of the attention it deserves. So if anyone knows a budding PhD candidate, please send them over. But what we should consider from this is that the risk for child-to-parent violence that's substance involved is increased by factors that relate to both the parent and the child. It's a dyadic issue within a broader family environment that needs to be acknowledged. It's not realistic to just take one person out of that equation. many of our behaviours, including aggression, they develop within the context of really substantial interdependence and social processes, especially in the family. What we can say is that young people with more negative emotionality than others who use aggression in the home, they're at greater risk of that aggression becoming substance involved and adding that additional complexity factor that would need to be addressed. And this is particularly likely when the parent is reporting being less aware of what the young person's doing, where they are, who they're hanging out with, so on and so forth. What we can also take from this is that it's probably helpful, very helpful as well, to work with parents experiencing child-to-parent violence on their use of alcohol, potentially other substances, and reducing this could help prevent the risk of the young person's aggression then becoming substance involved. It's a bit of an extension, but there's a lot of evidence to suggest that the parents' use of substances in the home has a really tangible effect on the young person's development and their behaviours, not just aggression, but for all sorts of outcomes as well. So it's not surprising that we find this here too. And I just want to end on the bigger picture that this all sits within, which is less to do with substances and more to do with addiction generally, which can also form around certain behaviours, things like gaming, internet, gambling, shopping, all sorts of things. There is a general trajectory across a lot of these more behavioural addictions that goes from initially rewarding to compulsive over time, which suggests that there's overlap in the processes that occur within the brain. And so it's likely that actually the same relationships that we find with substances will likely be found across a range of different addictions, including probably preaching to the choir here, internet and gaming, screen use. And there is some neurobiological evidence that maps this out and provides quite a compelling case for why we should expect that. But we do need to do a bit more in this application specifically. And a really important consideration when we're thinking about adolescent or children's use of violence in the home is that things like screens, internet, gaming, they're way more accessible to a young person than substances, and from a far earlier age as well. Sometimes these are also used as a way to manage aggressive behavior or to help the young person regulate their emotions from an early age. And it's actually possible because of that the relationship is stronger than substances for a lot of these behaviors, or more problematic, especially in earlier age groups. And just for context, in the research that we do, we consistently find that the age of onset for a lot of young people's violence in the home is mid to late childhood. It's happening from earlier than adolescence. And we hear from our clinical partners that we work with that getting young people off screens can be a really key factor in their experience of aggression from that child. So we do need to understand these mechanisms. They're important to working out when the behavior is most likely. And aligned with an addiction model, it's likely that the impact of screen use, the impact of gambling, of gaming, on the executive functioning system of our brain is playing a key role, like it is in substance use. But we don't really know much about that just yet. And our current and our ongoing work is starting to investigate some of the more acute, like situation specific, and the more chronic over time impact of these behaviours and child-to-parent violence, including both the behaviours themselves, so gaming, screen time, and when these also become, there's dependence on them. But taking a step back from that, it doesn't necessarily matter, right? Whether it's substances, screens, gambling, shopping, stealing. The reason why these addictions emerge and begin to feed into the conflict is much more important. These are typically almost all of the time, coping strategies that are likely symptoms of ongoing family adversity in the same way that the aggression is. And the risk within an addiction framework is that if we start to reduce things like screen use or gambling without addressing that, without addressing the role that that is playing in managing behavior or contributing to behavior, then the addiction will simply shift to another behavior, or perhaps even to substances later on. Sorry, that's a pretty negative thing to end on. But the important thing is that we've got this baseline understanding that we can draw a little bit from, and we're going to continue to do this work of applying this addiction framework to young people's aggression in the home with the help of a PhD student in the future. Come on down.
Thank you. Yeah, if anyone is interested in embarking on the journey of a PhD, it sounds like this could be a viable option for you. Given the, I guess, the importance or the extent to which substances can impact the use of violence, and you talked about those 3 factors: impelling, inhibiting, and instigating. Does this speak to the fact that practitioners working with young people using violence in the home, should they be specifically screening and asking very explicit questions around alcohol and substances, both for the young person and also the parent? Is that a potential takeaway from this?
Yeah, absolutely. I think just as we would consider it to be a huge risk factor in adult violence and adult aggressive behaviours, I think we need to be considering it in the same way when young people are engaging in aggressive behaviour in the home, particularly from our studies as they get into those later adolescent years. And I think the other relevant thing, of course, as you've said, Carolyn, is that screening the parents and seeing if the parents also need support. I think there are a lot of dual risk factors for the young person and the parent that if you can address them in a more family-based approach, then you're likely to get better outcomes in terms of reduction of aggression, and substance use is one of those. And the other factor I think that's important is that if somebody has been, and Travis touched on this as well, if somebody's been using substances to cope or, to feel good or to regulate or for whatever reason, and you kind of work on that, but you don't replace it with something else that's a healthier coping strategy or better regulation skills, then that is problematic as well. But the other factor that is important here is that when young people have been using substances over a longer period of time, and potentially there has been an impact on the brain, whether it's more of an acute impact or a longer term impact, we know that substance use can impact the brain for up to a year post-use, particularly if it's been chronic, then that has implications for intervention as well. So if you've been using substances chronically or you're intoxicated, that changes again the way your brain works, and you can't engage those cognitive processes you need to effectively engage in intervention and to effectively change your behavior. So it's a factor both in terms of risk and identifying if there's risk associated with it, but there's also an important consideration around intervention because A, you need to know whether it's something to target and find alternatives for, and B, it's going to have an impact on how well that person can actually engage with any intervention program and get positive outcomes.
Thank you. I would like to sincerely thank today's guests, Ashley and Travis, for sharing with us some really quite complicated, academic level research. So when you read the articles, it's one thing, but to hear them explained verbally and to have things really broken down, I think that's where we can get some really solid learning happening. Please stay tuned for a recording of the webinar. We'll send out again copies of those articles, and we hope to see lots of faces around at our next webinar and event. So thank you, everyone. Go well. Have a good week. Thanks.